If you're young, say you're in your 20s, you may wonder, what does breast imaging have to do with me? If you're of average risk, say you don't have any family members that have breast cancer, in your 20s, you typically won't have breast imaging. If you do have a concern in your breast, the first step is going to be an exam by your doctor. And again, we hope you're doing your monthly exams, and you should start doing that about your 20s if you haven't started earlier. So every month, about the same time in the month, examine your breasts and look for any areas that feel lumpy or thickened or different from the month before. If that stays there the next month, it's worth going in and getting a visit with your doctor. They'll start with a careful breast exam. Many times that's all that's needed. A lot of the tissue you're feeling is just the normal bumpiness and lumpiness that come with breasts. Now, if there is something you can discreetly feel, you can put your fingers around it and it feels like a pea or a grape or even larger, then you need to go in and again, they'll start with a breast exam. If your doctor or your nurse practitioner decides you need imaging, in your 20s we'll typically start with a breast ultrasound. Why do we start with the ultrasound? The ultrasound gives us great information about lumps. We can find out if it's a fluid collection, which is a common finding in young women. If it's a fluid collection, we know that's what it is and we can stop. Occasionally we will do a mammogram in a younger woman, but usually we'll start with the ultrasound first and then get the mammogram if we need it. Why don't we start with the mammogram? The mammogram in younger women, typically in their 20s, is going to show tissue that's very white. It's going to be basically a cloud of white on the mammogram, and we don't get a lot of detail. Masses can hide in all of that white, dense breast tissue. So again, not as helpful in a younger woman, and again, it does have radiation, unlike ultrasound, which uses sound waves. So the mammogram does have some radiation to it. So again, we like to wait until you're typically over 30, over 35 before we start doing mammograms. Now let's say you're not average risk. Let's say you have some risk factors that put you at increased risk of having breast cancer. Say you have family members, or say you're a patient who had lymphoma and you had radiation to your chest as a teenager. In those cases, we would ask that you have screening for breast cancer every year. But in your 20s, we're generally going to do breast screening with MRI. MRI, again, is a technique that does not use radiation, so we're not subjecting your breast to radiation at a young age. And again, it's actually very sensitive for finding out the changes we're looking for in high-risk patients. So again, an MRI, if you're high risk, may be started with. In most patients, though, if we're going to do breast imaging, we're probably going to start with an ultrasound. Rarely we might need a mammogram. Once you get to the age of 30, if there's a symptom in your breast, if you're feeling something or you have discharge or something doesn't just feel right, we'll probably start with a mammogram. By the age of 30 and over 30, mammogram's usually where we start. And again, we may supplement that with ultrasound or MRI in some patients. But again, in your 20s, the most important thing, do your breast exams, get your exam by your doctor, and again, if there's any change, talk to your doctor. If you're still worried, ask for imaging. And again, it may start with that breast ultrasound.